Honorable Chief Executive of the General Medical Council, Mr. Charlie Massey, Medical Director of the General Medical Council, Professor Colin Malvele, Professor Carrie, Honorable Chair of the General Medical Council. I am Dr. Muhammad Adil. I am Fellow of the Royal College of Surgeons of UK, and I've been working as a consultant surgeon with 30 years of unblemished record while working for the NHS in the United Kingdom. And I had made significant contribution in scientific innovation, teaching and training, research and publication, and promoting medical education within UK and across the world. I was suspended by the General Medical Council for the last 2.5 years, since 1st of June 2020, because of holding an opinion about COVID-19 and its far-reaching effects on the public, personal, and the private lives. Prior to that, I was dismissed by the trust I was working as a consultant general and colorectal surgeon in North Manchester Hospital Trust on 22nd of April 2020 because of my couple of videos on the social media where I was discussing COVID-19 and initiated a scientific debate between the scientists, health professionals, clinicians to discuss about the existence of the coronavirus, its mode of transmission, pathogenicity, and the way to curb the spread of infection. Unfortunately, I've been treated differently compared to the other local boys. For example, there are many white doctors from the United Kingdom. They have been treated differently than myself. For example, Dr. Steve James, consultant psychiatrist, King's College London, on 22nd of January 2022, he challenged Sajid Javed in accident and emergency department while he was working. And he refused to take vaccine, and he said that there is no data to support the benefit of vaccination. On his stance, 80,000 health professionals were saved for having a mandatory vaccination. But no action was taken against him, neither by the trust nor by the General Medical Council or the National Health Services. He was neither dismissed, like myself, in North Manchester Trust with immediate effect, followed by GMC suspension order for 2.5 years, and my license has been stripped off, but he is still working, and he has been treated differently than myself. That is total discrimination and racial abuse against myself and the other ethnic minority. Similarly, Dr. Hilary Jones, who is a GP in London, he comes in the morning show of ITV, Good Morning Britain, and he generated 4,000 complaints by the members of the public regarding the misinformation he spread regarding the unvaccinated patients in the London hospitals. 4,000 members of the public were very furious and cross against him, but no action was taken by the Ofcom, by the NHS, by the Trust, or by the General Medical Council at all. He is still active, and he is doing his program, and he's doing his private practice. Thirdly, Dr. Teslari, she is a PhD. She promoted ivermectin in collaboration with the frontline doctors of the United States. And she spoke against the vaccine COVID-19 mass mandate, but no action has been taken against her. She is conducting scientific meetings, and she's very active on the social media, and she's constantly writing against the COVID narrative, vaccination, social distancing, and all the measures which government had taken, but no action has been taken against her, either by the GMC, NHS, or by her organization. Similarly, Dr. Sam White is still working, and no action has been taken against him. Dr. Dave Cartland, one of the other GP, he spoke against the COVID-19. He refused to take a mask. He's not vaccinated, and he is very active, spreading the information on the social media and the various platforms, but no action has been taken against him. Why we have been treated differently than the local white doctors, which is totally discriminatory and racially motivated. My other colleagues, like Dr. Aurora Manjola, she was suspended because of a computer scam by the trust. And you suspended her first. She lost her reputation, damaged her career, and then after a few months, you reinstated her with an apology. Thirdly, you crucified Dr. Umar Karim, FRCS, consultant urologist, very competent and eminent consultant urologist working in London. He raised his concern regarding bullying and harassment within his department. You suspended him for 4 years. He was reinstated and proved innocent. He had to sell his house to educate his children. His children moved from the private school to the state school, and he went through a great deal of trauma, loss of reputation, career, financial damage, psychological impact, and damage to his family, children, and their well-being. None of the compensation of any kind can reverse his precious 4 years, which he has lost without working in a great stress and anxiety. Do you think this is fair and honest way to treat overseas doctors? There is another doctor who has been treated even adversely. Hundreds of doctors have committed suicide. 80% doctors from those belong to the ethnic minority who are considered to be the backbone of the NHS in many ways. And hundreds of doctors, they have died during the draconian and the barbarian GMC prolonged, painful, and barbarian investigations for years and years, which exhaust their funds, and they suffer from financial strain. They beg for mercy, for money, and for feeding their children. Did you ever had any remorse? Have you ever thought about those doctors who has given their youth in this country, for this community, for this society, and their children were born in here? They have come from abroad, and they made UK as their country, but they have been treated brutally and unfairly. So this is totally unacceptable, unwarranted, racially abused, and is not acceptable. This is a time to look into yourself. Think about it. Your GMC department is total barbarian. They are gone out of control. Their actions against the health professionals are very much vindictive, sclerotic, and overly bureaucratic. And the doctors have lost faith on you, and they don't want you to be their regulator because you are racially abusing them. And British Medical Council and Defence Medical Union and Medical Protection Society and the other human rights activists have taken this case further. And they all have raised complaint against you and against the Medical Act 1983, behind which you are hiding. This is the time to get training from somebody who can train you how to treat highly experienced, skilled, and qualified overseas doctors belonging to the ethnic minority who are backbone of the NHS in many ways, and their contribution cannot be forgotten. Remember, during the last COVID-19 pandemic, there are 350 overseas doctors. They were working as a frontliner, and they died during that crisis. You need to train your bureaucrats, who are the youngsters. They don't know what does it involve for formation of a doctor and obtaining a qualification, training, and reaching to my stage before becoming a consultant. And you need to tap the shoulders of your legal and the paralegal team and the managers and the senior decision makers and the assistant registrars. They all are abusing their office while sitting in the public office. We pay our subscription to you, but you use our money to fight against us, to defeat us, to crucify us, and to deprive us from our basic fundamental rights. Since 2.5 years, I am suspended. For what? For holding an opinion about COVID-19. I had a freedom of speech and expression, which is my fundamental right. according to the Human Rights Act, Article 1 and 2, which is permissible to any democratic society, like in Great Britain. I had no clinical issue. I had no complaint. I had no manslaughter. I've not done any sexual offense on anybody. Neither I had any complaint from any patient. I had no social or ethical concern, and I had no health issue whatsoever. But your action has spoiled my 2.5 years, my career, my reputation. I lost my job, my income. I was dismissed and suspended with 0 salary. And we went through great psychological impact, especially my wife and the children. They suffered a lot during these 2.5 years with financial hardship, loss of livelihood, and damage to their personality and their education. And you are responsible for that. You need to look into that seriously and reinstate all those doctors who have served, who have given their youth for this community. And now they've come to that stage when you have crucified them. So you need to look into this matter very seriously. We have requested to the Parliament and parliamentarians, Prime Minister, previous Prime Minister, to make robust changes in the Article Medical Act 1983, behind which you are hiding. And this is a time to look into yourself. And all the health professionals, more than 76%, they've lost trust on GMC, and they are not confident that you will be honest for any malicious or false complaint against them. So we will stand against you. Your public is against you. You've not done anything for public. There are more than 10 million people are waiting for the investigation, the treatment for the last 2.5 years. But what you have done in last 3 years for, you claim about upholding the standard of the medical education, safety of the patient and the public, but you have not done anything at all. Ask yourself what you have done in the last 3 years. And this is my question to you and all the health professionals, 75% health professionals in this country, they have turned against you, and because of your behavior. Unless you change your behavior, you're not going to survive. And we will need an alternate regulator to look after, to be honest, and to be fair, and to treat everybody with equality and justice, regardless of any color, race, individuality, religion, or any origin. Mind my word. Many thanks. Bye for now.